Next, I'm going to be testing for foot injuries. The special test, first one that I'm going to do is called the intermetatarsal glide test. And for this one, what I'm going to do is, again, the patient can be either sitting or supine with the leg off the table. And what I'm going to do for this one is I'm going to grasp the metatarsal bones, and I'm going to move the metatarsal heads in opposite directions, so anterior, posterior, for each one of those. And then what I'm going to do is I'm going to compare those and see if there's any pain in there, or there's an increased glide compared to the other foot. If there is, then this is an indication for a transverse metatarsal ligament or interosseous ligament injury. Next special test is going to be our forefoot neuroma squeeze test. And for this one, the patient is going to be supine or sitting with the leg off the edge of the table. And the therapist or athletic trainer will stand on their side, stabilizing the distal tibia, and then grab the foot like this. And then we're going to squeeze the metatarsal heads together with this one. And if they have increased pain or needle-like qualities in the foot, then that would indicate that they have Morton's neuroma, metatarsalgia, or arthritis in that area. Okay. Special test is going to be the supple planus winless test. For this one, we're going to ask the patient to sit with their foot off the edge of the table. They're going to be in a non-weight bearing position, and what we're looking for is the presence of the medial longitudinal arch down here, and we can even measure if we wanted to in our centimeters in a non-weight bearing position. And then we're going to ask the patient to stand. Have the patient stand with the body weight equally distributed between the toes and the whole foot. And what we're looking for is to see if the arch disappeared when the weight bearing on the toes and the whole foot. If it appears that when she's on the whole foot, then that would indicate that she has a rigid flat foot. If the arch disappears only on one of those positions, when she's weight bearing or when she's on the whole foot, then that would indicate that she has supple flat foot, and that would also indicate we would also refer her for orthotics for treatment. The special test that we're going to do is called a feiss line. And for this one, we're going to ask the patient to be in a non-weight bearing position with their leg off the edge of the table. And then I'm going to mark 3 spots with a pen. First one I'm going to do is going to be the apex of the medial malleolus. The second mark that I'm going to make is going to be on the navicular tubercle. And the third landmark that I'm going to make is going to be at the first metatarsal phalangeal joint. So if I flex that, I can find that joint. After I have those 3 points, I'm going to draw a line from the medial malleolus down to the first metatarsal phalangeal joint, like you can see that I've done here. And then what I'm going to do is I'm going to measure the distance from that line down to the navicular tubercle, and I'm going to use centimeters, and note that in a non-weight bearing position. Then I'm going to ask her to go in a weight bearing position, Weight bearing position, I'm going to have her with her feet about a shoulder's width apart, and then I'm also going to have her weight evenly distributed between the two legs. And then what I'm going to do is I'm going to, in a weight bearing position, again I'm going to measure the distance between the feiss line that I drew and the navicular tubercle in a weight bearing position. Again, I'm going to use my centimeters, and note if there's any differences. If the tubercle is above the line, then that would be an indication for a pes cavus. As the tubercle intersects the line, then that's normal. If the tubercle is below the line, then that indicates a pes planus. And a pes planus foot can reduce the shock absorption capacity, and pes planus foot type is often hypermobile. The next test is going to be the navicular drop test, and for this test we're going to ask the patient to sit with both sitting in a chair, and what we want is her foot on the ground. We want the subtalar joint placed in a neutral position with the patient's foot flat on the ground, but in a non-weight bearing position as sitting. With the patient sitting, we're going to place a dot over the navicular tubercle, like I did there, while the foot is still in contact with the ground, but non-weight bearing. I'm going to place an index card next to the medial longitudinal arch, and then I'm going to make a mark on the card indicating the height of the navicular. Okay. Then the patient is going to stand with the body weight equally distributed between the 2 feet. The foot is allowed to relax into pronation. A new level of the navicular tuberosity is identified by marking on the card again. So this one was just below the landmark. And what we're doing for this one, this is now in a weight bearing position, and a positive test is when the navicular drops greater than 10 millimeters. Norma values are for restricted navicular drop have not been established. This is an indication for limited or excessive pronation. That's it.